10 bad things obesity does to your body. Hello and welcome to the channel. Today I'm going to discuss a sensitive issue that affects almost 1 in 3 people in the world, wherever you are. It used to be a problem of the Western countries, but now it is fair to say that the rest of the world has firmly caught up. We are going to discuss obesity. As ever, I discuss topics from a medical point of view. No shaming, no guilt trips, just useful information for health. If you are sensitive, however, to a difficult topic such as this, feel free to skip this one and I shall see you in the next video. First up, let's define obesity according to body mass index. A healthy weight is 18.5 to 24.9 body mass index, and that is your weight divided by your height squared in kilograms per meter squared. Overweight, including obesity, is more than 25 body mass index. Obesity is defined as more than 30 body mass index, and severe obesity is more than 40 body mass index. Now, just a word about body mass index. Body mass index, which is based on the height and weight of a person, is an inaccurate measure of body fat content and does not take into account muscle mass, bone density, overall body composition, and racial and sex differences, which are all factors that can affect your weight, but are nothing to do with body fat, which is what counts. So we can take body mass index with a pinch of salt. If we do, then we have to use a more accurate way to measure body fat, which is the bad guy in the story. But then again, there is such a thing as healthy fat and bad fat, aka brown fat and white fat. But perhaps that discussion is for another video some other day. Otherwise, we're going to be forever chasing our tails in this video. Let's just say, for the purpose of this video, that by obesity, I mean an excess of white bad fat. Obesity is one of the most significant public health challenges worldwide. Defined as an excessive accumulation of body fat, it is not just a matter of appearance, but a medical condition that has far-reaching consequences on nearly every system in the body. While many people are aware of the aesthetic or social stigmas attached to obesity, fewer realize the profound and complex impact it has on health. This video will try to explore 10 major ways that obesity negatively affects the human body, delving into both the short-term and long-term health risks associated with it. First port of call is increased risk of cardiovascular disease. One of the most critical ways obesity harms the body is by increasing the risk of cardiovascular disease, diseases of the heart and circulatory system, blood vessels. Excess body fat, especially visceral fat, the fat around internal organs, is strongly linked to high blood pressure, high cholesterol, and an increased likelihood of atherosclerosis, the buildup of fatty deposits in the arteries. These conditions collectively increase the risk of heart attacks, strokes, and other cardiovascular events, so to speak. Obesity often leads to high blood pressure because the heart must work harder to pump blood through a larger body. Additionally, obese individuals typically have higher levels of low-density lipoprotein, LDL, cholesterol, which is known as the bad cholesterol, which can deposit in the arterial walls, leading to blockages that restrict blood flow. Over time, this can cause significant damage to the heart and blood vessels, resulting in heart disease, heart failure, or stroke. Moreover, there are scientists and medics who firmly believe that it is not only cholesterol which is dangerous in terms of cardiovascular disease, but actually the visceral fat itself, the fat that surrounds your vital organs, your heart, liver, pancreas, gut, and so on. We can't measure visceral fat, of course, but we can sometimes see it. But don't get complacent, thin people. It is the case that in some people, visceral fat is well hidden, the so-called skinny fat people. A good tip for the skinny fat people is to actually build muscle. I can get into why in a future video. It's really a long, complicated story. Number 2 is the development of type 2 diabetes. Diabetes is another severe consequence of obesity. In obese individuals, the body becomes resistant to insulin, the hormone responsible for regulating blood sugar levels. Insulin resistance means that the cells of the body cannot effectively use glucose, leading to elevated blood sugar levels. Over time, the pancreas may struggle to produce enough insulin to keep up with the body's demands, resulting in full-blown diabetes. Chronic high blood sugar associated with diabetes can damage blood vessels and organs, leading to complications such as nerve damage, neuropathy, kidney damage, nephropathy, and visual problems, so-called diabetic retinopathy. People with obesity are significantly more likely to develop type 2 diabetes, and this risk increases as body mass index rises. The relationship between obesity and diabetes forms a vicious cycle, as high blood sugar levels also contribute to further weight gain and worsening of insulin resistance. Number 3, respiratory problems. Obesity places a significant strain on the respiratory system, leading to conditions such as sleep apnea, asthma, and other breathing disorders. Excess fat around the neck and abdomen can restrict airflow and compress the lungs, making it difficult to breathe. This is particularly problematic during sleep, where individuals may experience obstructive sleep apnea, a condition in which breathing repeatedly stops and starts during the night. Sleep apnea not only leads to poor sleep quality and daytime fatigue, but also increases the risk of serious conditions like heart disease and stroke. Obesity-related respiratory issues can also worsen conditions like asthma, making it harder for people to manage their symptoms and increasing the likelihood of asthma attacks. Increased risk of cancer is number 4 on my list. Obesity is a well-established risk factor for several types of cancer. Studies have shown that individuals with obesity have higher rates of breast, colorectal, endometrial, kidney, and liver cancer, among others. The exact mechanisms by which obesity increases cancer risk are complex, but they are thought to involve chronic inflammation, hormonal imbalances, and increased levels of insulin and insulin-like growth factors, which can promote the growth of cancer cells. Fat tissue produces estrogen, a hormone that has been linked to breast and endometrial cancer in women. In men and women, obesity can cause chronic low-grade inflammation, which can damage DNA and lead to the development of cancerous cells. As obesity rates continue to rise globally, so too does the burden of obesity-related cancers, making it a significant public health concern. Number 5, joint and musculoskeletal problems. Carrying excess weight naturally puts immense stress on the musculoskeletal system, particularly the joints. The knees, hips, and lower back are especially vulnerable to damage because they bear much of the body's weight. Obese individuals are at increased risk of developing osteoarthritis, a degenerative joint disease characterized by the breakdown of cartilage that cushions the joints. The mechanical stress on joints from carrying excess weight accelerates the wear and tear on cartilage, leading to pain, stiffness, and decreased mobility. Over time, the reduced mobility associated with osteoarthritis can further contribute to weight gain, creating a vicious cycle of joint deterioration and weight-related complications. In addition to osteoarthritis, obesity can also contribute to back pain, herniated discs, and other spinal problems. Number 6, fatty liver disease. Obesity significantly increases the risk of non-alcoholic fatty liver disease, a condition in which excess fat accumulates in the liver. Non-alcoholic fatty liver disease is the most common cause of chronic liver disease in the Western world, and its prevalence is rising in tandem with obesity rates. Fatty liver disease can progress to more severe conditions such as non-alcoholic steatohepatitis, liver fibrosis, and cirrhosis, which can all lead to liver failure. Non-alcoholic fatty liver disease is closely linked to insulin resistance, metabolic syndrome, and type 2 diabetes, all of which are common in people with obesity. The accumulation of fat in the liver can trigger inflammation and scarring, eventually impairing the liver's ability to function properly. In its advanced stages, chronic fatty liver disease can necessitate a liver transplant or lead to liver cancer. Number 7, impaired immune function. Obesity has a detrimental effect on the immune system, making individuals more susceptible to infections and illnesses. Excess body fat is associated with chronic low-grade inflammation, which can interfere with the immune system's ability to respond to pathogens, bugs, effectively. Obese individuals have been shown to have impaired immune responses to infections, vaccines, and even wound healing. We saw a little bit of this in the COVID-19 pandemic, where many individuals who were obese were more prone to not only having a more severe variation of COVID, but also sadly were more likely to die from COVID. Chronic inflammation caused by obesity can disrupt the production and function of immune cells such as T cells and macrophages, which play a crucial role in defending the body against infections. This impaired immune function may explain why individuals with obesity are at greater risk of severe complications from infections like the flu, pneumonia, and COVID-19. Number 8, psychological and emotional impact. While the physical consequences of obesity are well documented, the psychological and emotional toll should never be overlooked. Obesity is often accompanied by feelings of shame, low self-esteem, and depression. Many people with obesity face societal stigma, discrimination, and negative body image, all of which can contribute to mental health challenges. The psychological effects of obesity can create a vicious cycle where feelings of anxiety or depression lead to emotional eating and further weight gain. Studies have shown that obese people are at higher risk of developing mood disorders such as depression and anxiety. Moreover, the social isolation that can accompany obesity may exacerbate these mental health issues, leading to a diminished quality of life. Number 9, reproductive health issues. Obesity can negatively affect reproductive health in both men and women. In women, excess body fat can disrupt hormonal balance, leading to irregular menstrual cycles, ovulatory dysfunction, and infertility. Polycystic ovary syndrome, a condition often associated with obesity, is one of the leading causes of infertility in women. Additionally, obesity during pregnancy increases the risk of complications such as gestational diabetes, so diabetes in pregnancy, preeclampsia, and the need for cesarean delivery. In men, obesity is linked to lower testosterone levels, reduced sperm quality, and erectile dysfunction. Excess fat in the abdominal region can also increase the temperature around the testicles, impairing sperm production and leading to fertility issues. The reason the testicles are outside the body is, of course, to create a cooler environment for sperm. If you increase the temperature, if you warm up the area where the sperm are produced and stored, you can impair the function of the sperm, and indeed you can kill them. The hormonal imbalances and metabolic disturbances caused by obesity can significantly affect reproduction or reproductive function, making it more challenging for obese individuals to conceive or reproduce. Number 10, reduced life expectancy and quality of life. Perhaps the most sobering consequence of obesity is its potential to reduce life expectancy. Obesity is associated with a range of chronic diseases, including heart disease, diabetes, and cancer, all of which can significantly shorten a person's lifespan. Research suggests that individuals with severe obesity may lose up to 10 years of life compared to those with a healthy weight. In addition to its impact on longevity, obesity can also reduce quality of life. Chronic pain, mobility issues, fatigue, and the emotional burden of living with obesity can make everyday activities challenging. Many obese individuals experience a diminished ability to participate in physical activities, social events, and even basic self-care tasks, leading to a lower overall quality of life. The combination of physical, emotional, and social challenges associated with obesity can create a cycle of poor health and reduced well-being. So we have come to the end of my 10 complications of obesity. I have a bonus complication: the skin. Skin changes associated with obesity are either due to a direct effect or due to secondary complications like diabetes. These include increased risk of infection, bacterial or fungal, increased risk of corns and calluses on the skin of the feet due to friction and increased load, and even the risk of skin cancer, melanoma, is massively increased in obese patients. Another association I have personally noticed with obesity is with a condition called hidradenitis suppurativa. This is an illness where there appears to be an eruption of boils and abscesses anywhere on the skin, but particularly in areas where you find hair follicles, especially in the armpits and groin regions. This illness is one of the autoimmune illnesses actually, but I have to say that from my own experience, I notice it more in obese people, whether or not they have the additional risk factor of diabetes, which is of course an illness that predisposes one to infections of all sorts, including those of the skin. Whilst you will never find an entry on a death certificate of obesity as a direct cause of death, the truth is obesity is killing large segments of our society softly and slowly. This is tragic. We should do our best to keep our weight and that of our loved ones, especially children, under control to enable us to get the best out of life. I have a resources section on this channel, including weight loss strategies, in addition to the many videos I have made on this subject. Take advantage of the resources. I never promote something that is harmless or useless, so feel free to try the resources you find and give me feedback. If something you try on this channel is consistently not working for you, I will remove it. Let's aim for a healthy life, all of us together. Have you had battles with your weight? Do you think one can be obese and healthy? How does one keep the weight down for life without engaging in time travel? Is modern sedentary life to blame for our collective obesity? Tell me all your thoughts. Any questions? Go ahead, ask me. Ask a doc.